Okay, hey guys, we're live on Facebook and on YouTube. It's Friday. We're doing an Ask Me Anything session once again. So as people start jumping on, we'll start to answer questions. So while I'm waiting for people to log on, I'm just going to make sure everything is apparently working. Looks like it is so far. So it's 5 o'clock, as promised, Friday afternoon. Answering your questions. So if you're jumping on the stream, say hi, let me know you're there, let me know you can hear me. Every now and then the sound doesn't work right, so I just want to be sure everything's working. If you can hear me and see me, let me know. All right. So just waiting on some questions to pop in. Did have a video that I just put up the other day that if you haven't seen on the YouTube channel, you should definitely check out. Hey folks, we're jumping on YouTube and I see some folks jumping on Facebook. So as you're jumping on, say hi, let me know you're here. Hey Nikki, how's it going? Aislinn, thanks. You can hear me, that's good. Looks like things are working. So welcome guys, Friday afternoon. If you have questions, hit me up here. And while I'm waiting to see what you guys have to say, I'm gonna look back and remember what the heck that last video was I made over on my YouTube channel to let you know. I've made too many videos at this point, I forget what the last one was. All right, let's see. What did we do last? Oh yeah, the last thing I made was a video about this, this medication called Orilissa, which is a new med for endometriosis. So just came out last month. It is a hormonal treatment for endometriosis that is new, different from anything else that's out there in the sense that it's an oral medication. It is what we call a GnRH antagonist. So it's like Lupron was, Lupron's a shot. So Orilissa is actually a pill. And appears to be there appears to be less side effects with that one than say than the Depo-Lupron. It's oral as opposed to a shot. It's in your system for less time. And yeah, new Endomed. Yeah, Jenny's Jenny's naming off videos that I made. You're right, Jenny. Thanks. So yeah. So Nikki says, I'm not preggo. Okay, we'll start with that. Okay, thanks. But what do you recommend about being pregnant and handling exotic animals? That's an interesting question. I think in theory there's some potential. Some of those like reptile type things apparently carry salmonella, which is a bacterial infection, or is a bacteria, which could cause an infection. And so definitely if you were to do something like that, I just encourage you to wash your hands really well. And before you put anything in your mouth, make sure your hands are clean. And I think probably you're fine, but I don't have anything specific beyond that. But that's about the only thing I know about amphibians. I didn't really have very much of that in school. Jenny, how soon can you detect pregnancy in lab work? Essentially from a missed period, and maybe even from a day or two before you would miss your period with a sensitive blood test. But generally speaking, I just recommend to folks, when it's time for your period, if you don't have it, that's a good time to check a pregnancy test. Pretty reliable at that point. And you may see, early stuff that then doesn't pan out if you're checking it really, really soon. So I figure if you miss your period, that's a good time to start checking tests at the soonest. So hope that answers your question. So hey, welcome to folks who are jumping on. It's Friday. We're going a little bit later on this afternoon. Had some babies earlier, so couldn't do it at my normal time, which was 2 o'clock. Let me know what you think about the 5 o'clock time. Live at 5, Facebook Friday. It kind of rhymes, so that's interesting and has a catch to it. All right. Let's see. Lisette says, what labs are usually run for recurrent miscarriage? Know your blood type and did the autoimmune test already. Well, if you're talking about autoimmune tests like the anti-phospholipid antibody workup, that's one. The blood type's not really something that we think plays a role with recurrent miscarriage per se. It's important to know your blood type, of course, because if you're Rh negative, that has some implications. Beyond that, there are a couple things. First off, I want to tell you, there's a video that goes really in depth in this on my YouTube channel. It's called Evaluation of Recurrent Miscarriage. So it's in the playlist that's like called Infertility Trying to Conceive. I think it's on that playlist. And it goes into it in a lot of detail. So I'd encourage you to watch that. But I will rattle off the things off the top of my head, but then check out the video because it'll be more complete. So the main things we think about include potential for uterine abnormalities. So we typically would shoot contrast dye up into the cervix to watch it fill up the uterus and make sure that the uterine cavity is normal. And then the lupus anticoagulant, anti-cardiolipin antibodies, that's that anti-phospholipid antibody stuff. So we check those. And then, you know, if those are normal, definitely making sure your thyroid's good. Also, there's some evidence about vitamin D levels, so I typically check vitamin D nowadays. And then the other stuff is less common, but you do see some recurrent chromosomal abnormalities in people. There is this thing called a balanced translocation, and it can cause recurrent miscarriage. So those are the type of things that we think about just, you know, right off the top. So, and like I said, if you want more info, check out the YouTube channel. Probably most of you already know what it is, but I'll just throw it in there real quick in the comments. So the YouTube channel name is Wes D Ski. If you go there, you will find it. Cool. Okay. Hey, Keely. See you over here on YouTube. Let's see what she's got to say. 16, almost 17 weeks. Starting to know where to go. Whoop, come back. Hang on. Sorry. There it goes. Some pain in your sternum. A lot of things definitely do get uncomfortable. So, you know, about the only thing that I'd say that, you know, worrisome from you're pregnant, chest pain is, we must have a visitor. With chest pain is certainly feel like pressure, shortness of breath together, those two things. You know, especially if you're further along pregnant or you're postpartum, you got to worry a little bit about pulmonary embolism, which is rare, but does happen. And so, you know, if you're having severe chest pain, shortness of breath, then I think that's a go to the emergency room type deal. But if it's just kind of the vague discomfort, it's probably nothing to worry about. You may also see reflux causing some chest pain. So those are two of the more common things. And it is also important to know that some mild shortness of breath throughout pregnancy is pretty typical. So that in and of itself is not a big deal. But if you have severe shortness of breath where you just can't like put two words together, that's definitely an issue that needs to get checked out. Okay, so let's see, Nikki, PCOS cycles all over the place, using metformin, looking into keto. What should you be on the lookout for? The main thing I'll tell you, Nikki, is the keto diet is something you shouldn't do if you're trying to get pregnant. There's a video on my YouTube channel about that. There's evidence that the keto diet's associated with a higher risk of spina bifida in babies where moms are on the keto diet. Now, it's not clear if that's only because of excluding folate from your diet, which you pretty much would do if you were purely keto, or is there something to the ketosis that's causing some malformations? That part's not worked out for sure, but I definitely don't recommend doing the keto diet if you're trying to conceive. Now, if you're on birth control and you're not worried about getting pregnant, then, you know, I think it's fine. It's like any other diet probably. If it works for you, that's probably fine. Let's see. Heidi, am I taking new patients? Yes, I am. Want a second opinion about PCOS, not getting pregnant? Yeah, come on in. Metformin and Clomid aren't working. There's other things we can do. You know, one of the typical meds that we use in that situation might be Femara, and maybe you haven't tried that one yet. And if not, there's some other things that we can do. So definitely give us a call. Happy to see you. Nikki, 3 kids is more than enough. Would rather just know that it's coming. Gotcha. I think you mean your period. Yeah. Yeah. Well, and you know, and if I don't know what you're doing for birth control, I can't remember, but you know, if you want to do something hormonal, that would probably regulate your periods in the meantime while you're trying to get everything else straight. So something to think about. Cool. All right. Well, I see some folks jumping on Facebook and also on YouTube. So if you guys have questions, fire away, put your questions in the comments, and I'll be happy to answer them. Let's see. Brandy says, if I had preeclampsia in your first pregnancy, will you get it on the second pregnancy? No, it's definitely not a will you, or you will rather. There's a risk. It's somewhere in the neighborhood of 20-30% recurrence risk. You can reduce that risk with low dose aspirin, about 120 milligrams a day, so like half of a 325 aspirin. Start that up after about 12 weeks. There's evidence that reduces the risk. So, you know, I would definitely consider that. There's a video on my channel that talks about that in some more detail, but that's the gist of it. Let's see. Jenny, how soon after ovulation can you have pre-parid symptoms? I'm not sure what that maybe you mean pregnancy symptoms. I don't know if the autocorrect got you there. But kind of the same answer. I mean, most folks may not notice any signs or symptoms of pregnancy till even 5 or 6 weeks. Some people notice them sooner. Some people, get breast pain or nausea pretty quick. Everybody's different on that, but so I'd say on average, 5 or 6 weeks before you're going to start to notice much, other than obviously when you miss your period. All right, Nikki says her husband's fixed. Birth control hates me, so it's all on him. Gotcha. All right, awesome, cool. All righty, well, everybody's jumping on. Yeah, pregnancy. Okay, yeah, pregnancy symptoms. That's what I thought. Cool. All right, well, if you guys have other questions, fire away. I'm just waiting for some more stuff to roll in. Okay, so Paige, thanks for your question. Thanks everybody for your questions so far. Had your blood glucose 2 weeks ago, just found out you didn't pass, go in next week for 3 hour. What's the chances? Third pregnancy, never had issues before. I don't have a number off the top of my head, but it's definitely the majority of people do not wind up having gestational diabetes. So you're positive on the 1 hour and then normal on the 3 hour test. But the only way to know is to do the test. So I definitely encourage anybody who had an abnormal 1 hour test to go ahead with the 3 hour and just kind of hope for the best. But it's hard to give you a number. But it does make you more encouraged if you've never had the problem before. But even so, I'd still do the test to make sure. Riley, thoughts on progesterone creams? Kind of a vague question. I don't know if you had something specific you had in mind there. I mean, progesterone is a hormone that's certainly used for various reasons, whether pregnant or not pregnant, menopausal or not menopausal. Cream in and of itself is just another way to administer it versus, a tablet or a patch or whatever. So in and of itself, don't have a positive or negative thing is fine. I don't know if you had something specific in mind that you're trying to ask. So if you do, fire away. It's kind of hard to answer it much beyond that based on what I've got so far. All right. All right, well, seeing some folks jumping on. If you're just jumping on, welcome. It's Facebook Friday. We're live at 5 today. This is a little bit different time, often more in the 2 o'clock neighborhood, but had some babies earlier, so here we are. So if you have questions, fire away. I'm just waiting for those to pop up in the chat so I'll know. Here comes one. Jenny, been trying to get pregnant, feeling a little nausea, sensitive, some smells, negative urine test, periods due in 2 days. Could you be pregnant? Yeah, it's possible. I mean, bottom line is, wait a couple days, do a blood test, see what happens. Fingers crossed, and good luck. Let's see. I thought I saw something pop up over here on YouTube. Let's see what it was. Let's see. Clomid gets pregnant, but you can't stay pregnant. Thinking of supplemental. Oh, got it. Okay. So progesterone supplementation for recurrent miscarriage. Not great evidence, but I think there's absolutely nothing harmful about doing that, and I have done that. We use a lot of Prometrium, which is just a pill. It's micronized progesterone, which is very similar to what your body makes naturally, so kind of like that one. I don't think the cream is any better or worse. I think it's fine. And there's also vaginal gels sometimes people use. There's just not great evidence that it prevents miscarriage. So that's the hard part is, there's just not tons of things. Once you go through the evaluation for recurrent miscarriage, and everything checks out normal, it becomes a little bit discouraging because it's like, well, we're doing everything's fine, now what? And a lot of times the answer is either keep trying or maybe consider stepping up your game to in vitro. And the reason I say that is that sometimes recurrent miscarriage is related to poor egg quality. And that's one of those things that is really, there's no good way to detect it with a blood test or anything else. But you can see that at in vitro. So when they do, first thing is a lot of people don't, if they have bad egg quality, don't respond as well. You might not make as many eggs. And of those that are retrieved, a lot of them might not fertilize. But the idea with in vitro is you can kind of ramp that process up and really stimulate the ovaries and hopefully get a bunch of eggs. some of which are going to be okay. And then when they fertilize in the in vitro lab, they can actually look at the embryos and sort of rank them by quality, and you can put back the best one. And I think sometimes that gets around the problem if you've had a completely negative evaluation. So that's something to consider, and I do recommend people at least go talk to the specialist about that. When you've been through everything else, you've had several miscarriages, and nothing's working for you. That's something to consider. Okay, let's see. Erica, can breastfeeding cause anemia or some other deficiency that would explain bruising? Yeah, I wouldn't think so. I'm not aware of any deficiency that breastfeeding would lead to in and of itself. Bruises are fairly common. The simple things are just do like a simple blood count to make sure your platelets are normal. Wouldn't have anything to do with breastfeeding, but as just part of that evaluation for easy bruising. If you've never had bleeding problems in your life, then you probably don't have some other type of bleeding disorder, particularly if you've had babies and never had a problem. So I don't think you need to go into too big of a workup, but I say at a minimum, check a blood count, make sure your platelets are normal, and it might be low for some other reason unrelated to breastfeeding. Let's see, Brittany, what can you do for adhesions after C-sections? That's a good question, and the answer is not much. The amount of scar tissue you form is probably at least in part genetic, and then a little bit maybe surgical technique, and a lot of just luck. So as far as treating them goes, surgery obviously is about the only thing you could do. The issue, of course, is if you open somebody up or go in with a laparoscope and take down adhesions from prior surgery, a lot of times they just reform. And so maybe it helped for a minute, maybe it didn't, and you might actually make things worse by trying to take down some of those adhesions, and then they just get worse. So not a ton you can do about that, unfortunately. And when you're already in this situation where you've had C-sections, not much you can do about that. Trying to prevent that first C-section, trying to have a vaginal birth after C-section, if you did have one, is probably the best thing you could do. But when you're already in that situation, there's not a whole lot more you can do, really, unfortunately. Okay, let's see. Jenica, if you had your tubes removed, could you get pregnant? Can you reverse? If they've been removed, you cannot reverse that if they're gone. Now, if you had a portion of tube removed, there's a possibility that if there's enough tube left, particularly if the distal end of the tube, that's called the fimbria, if it's still there, and if there's about 4 centimeters of tube length to work with, then sometimes you can put those back together. But if they were straight up removed, then you can't reverse that. And a lot of times people in that situation, if they do, unfortunately, find themselves like that, in vitro is the answer. I mean, as long as you have ovaries and a uterus, you can still get pregnant. It's just a little more high tech. And also, actually, in some ways, it's maybe better because if you did do a surgery to reverse your tubes, number one, the insurance is not going to cover it. It's going to cost over $10,000 probably. And then if it was successful and you became pregnant, there's a higher risk of tubal pregnancies because scarring in the tubes. And then lastly, when you're done again, now you got to figure out how to get sterilized again if you chose that route. So it winds up maybe costing twice as much than just a simple round of in vitro. And then you don't have to worry about fixing your tubes again later, or going through the surgery, it didn't work, and now you're back. So you might think about in vitro in that situation. And we send most everybody around here to either Reproductive Care Center or Utah Fertility. Those are the two that have offices here in the area, and then on down the road at the University of Utah as well, of course. Let's see, Carissa, when trying to conceive, should you wait a certain amount of time to go to the bathroom after intercourse? No, it's fine. And actually there's a video in my playlist called Infertility / Trying to Conceive, and it is called something along the lines of like maximizing your natural fertility. And I talk a lot about this concept, like do you have to lay flat, do you have to be in a certain position, whatever. And the answer is no. Sperm get up in the tubes really quick. And it doesn't make a bit of difference what position you're in after intercourse. And there's no period of time you need to wait. So don't worry about that. And in fact, it's probably a good idea to get up and pee pretty soon after sex, just because of the higher chance of bladder infections if you don't. So let's see. Vanessa had a postpartum hemorrhage after baby. 2 months postpartum now, and you start your period. Did blood vessels to be white with a red middle? Do blood vessels tend to be white with a red middle? Honestly, I don't understand that question. I'm sorry. maybe try to clarify. I'm not quite sure what you're asking me there. Let's see, Tara. How far in advance should a woman start taking folic acid before trying to get pregnant? Probably, ideal world is a couple months, maybe 3 months. Longer the better, because you want to have a therapeutic folic acid level before you get pregnant, so that when your embryo is forming, it has a lower risk of developing spinal cord defects like spina bifida. So the longer the better, and no time like now to start them up. Okay, so let's see. Kelsey, when should you head to the hospital with contractions? I tell everybody pretty much the same thing. If you're feeling contractions that are coming and going like every 5 minutes for an hour, and they are regular and they're at least somewhat painful, my advice, head in and get checked out. It's hard to know beyond that. Everybody's different. Some people's labor course takes 40 hours, some people's takes 4, and it's hard to predict who's going to be who. So I try to just keep it simple. If they're every 5 minutes for an hour and it kind of hurt, I'd head in. Let's see, Brittany, how can you differentiate between adhesions and a hernia? Incisional hernia, for example, there should be a bulge that would be visible or that you can feel in the scar. And that happens, but actually quite rarely after C-section. So it's unlikely to be that, but not impossible. If you have a visible bulge at your scar, then it's worth getting checked out. Some people have umbilical hernias, so like our little hernia at your belly button. They can be painful, they're often not, and they're typically related to just your abdominal wall kind of stretching out from having the baby, and then it might make a little weakness there where you can get a little bulge. So, but if you have a bulge there at the incision, it's worth getting checked out probably. All right. Hey, some folks are jumping on. Welcome, we're live. If you have questions, put them in the chat. We'll answer them for you. Yeah, I think I'm caught up for now. So I'm waiting for some questions to pop up in the chat. So hit me, guys. Let's see. Allie, stopped nursing about a month postpartum. Every time you had let down, like a small panic, anxious attack feeling. Is that common? I haven't heard that one actually. I mean, it certainly sounds like it was related because you said every time. So it might very well have been related. I don't know if you're going to have that happen again or not. That's not a very common thing. I don't think I've ever heard anybody say that. Maybe if any other moms are out there that have had that thing, throw it up in the chat and let her know. But to me, that's new. Always we've kind of felt like oxytocin, which is the hormone that you release for letdown, is kind of called like the happy drug. It's supposed to be associated with good feelings. So I'm not sure what was going on there. Sorry, I don't have a better answer. Let's see, Ashley, bad hemorrhoid, what do you do? Tried all the things, big, red, and hard. Yeah, it's there's not a ton you can do. You can ice it just to kind of help reduce the pain. If it's hard, that it might be thrombosed or have a clot in it. They can be, you can make an incision in the hemorrhoid and you can sometimes get the clot out. It can be a little painful to do, but sometimes is helpful and can give you relief. I've not personally done a lot of those. I have referred 1 or 2 folks to a general surgeon to do that. And they're not super duper enthusiastic about doing it just because you're pregnant and they don't want to mess with it. But that's an option. That's an option. All right, let's see. Just saw something pop up over here on YouTube. Let's see what it was. Let's see. Are bad eggs hereditary? Well, egg quality, probably not. Although there may be some tendency to accelerated loss of egg quality, like at a younger age or whatever. That could be hereditary, but I wouldn't think beyond that. Are there any proven natural ways to boost sperm count and motility? The only thing that I would tell you for sure is there is some evidence that pesticides, so residual pesticides that are on conventionally grown fruits and vegetables, have been associated with reduced fertility. And that probably could play a role in sperm quality for men. So going organic, there's probably nothing wrong with that, and there might be some benefits, so I'd consider that. I would maybe talk to a urologist if your husband's been told he has a low sperm count, see if they have other recommendations. There's the Great Boxer versus Brief debate and the temperature thing and all that, and I don't know how much of a thing that really is, but you could maybe have them talk to a urologist to get their opinion on that. Let's see. Uh, so Vanessa, okay, she's giving me a little follow-up here about the bleeding that she had postpartum, the blood clot that was white and red. I'm not so concerned about the color of the clot. It's more about the amount of bleeding. So I would tell anybody that if you're concerned about your bleeding, if you're bleeding through more than a pad or two per hour for more than a couple hours and it's not slowing down, I'd get it checked out. Beyond that, not so worried about a blood clot, a single blood clot per se. Okay, let's see. Lonnie said she had the same thing, and son wouldn't latch, and nursing was a nightmare, and finally gave up and switched to formula. So, maybe it's something to do with that. Maybe with if you're having difficulty nursing and that's causing some anxiety, that may be part of it. But it's good to know that Allie's not alone. Other people out there have experienced the same thing. If anybody else has any input, put it in the chat. Let's see. I had a question pop up over here. If I could get it to work. Dang it, sorry. Sorry if you're on YouTube and I can't get the comments to load. It's on my phone and it's acting weird. Hang on. There we go. Miriam, what are you supposed to get pregnant after IUD, trying to conceive 5 months? So IUDs, when IUDs are removed, they are immediately reversed. So I don't think there's any concern about residual fertility concerns after IUD removal. So, and if you've been trying for 7 months, there's not any major reason for concern there. I mean, it's the technical definition of infertility is trying to conceive for a year without getting pregnant. So you're getting close, but you're not there yet. You might check out the video on my YouTube channel that talks about maximizing your fertility. There's some tips and tricks in there that you might try. And if you hit a year not pregnant, then I definitely recommend to see your doctor and have a conversation, start getting checked out. Let's see. Megan, can you explain prostaglandins and the menstrual flu? Like what causes it? Why people have it? Is there any way you could do? That's a good question. So some people have a lot of pain with their period that is not related to anything like endometriosis or whatever else. It's just inherent within their uterus. The uterus is very crampy, and it is related to this whole prostaglandins business. There's different types of metabolism for prostaglandins, and it's long and boring, and I'm not going to try to remember it, and I'm not going to bore you with it. But the bottom line is that some people are more prone towards one pathway of prostaglandin metabolism that makes them more crampy, and some of those prostaglandins may make you feel kind of fluish as well. So I think it's probably something along those lines. The other thing that you might consider doing, if that's the case, there's evidence that non-steroidal like ibuprofen or naproxen can alter that prostaglandin metabolism, and that might help with some of the symptoms, so you might consider that. Beyond that, kind of hard to say, but that's what little bit we know about that topic. Let's see, Jenny, first baby came by C-section, what's the potential of happening again? Hard to answer that question, but I'll give you a different question that I think is maybe more answerable, and that is, what's the chance I'll have a vaginal delivery next time? So there is a calculator that you can input your own personal data into. It includes your height, your weight, your ethnicity, and the reason for the C-section. Have you had prior vaginal deliveries or vaginal deliveries after your prior C-section? And when you put all that information into this calculator, it'll tell you what the % chance is for success. And if you hit 60% or better, my advice is always consider trying for a vaginal birth. And that calculator is called the Maternal Fetal Medicine Units Calculator. There's a link to that on my YouTube video that is probably number one or number two on my homepage of my YouTube channel. It's called Vaginal Birth After C-section. You can do it. And she got stuck. Yeah, that was the reason for your C-section. So if you put your information in there, you can get a number. And if you get 60% or better, my advice is you might consider trying, because the recovery is so much easier. The risks are actually lower to have a vaginal delivery than they are for a repeat C-section, assuming you're successful. So that's why that calculator is useful, because it gives you a feel for what your predicted chance of success is. Let's see, Jenica says, any early signs, symptoms for cervical cancer? Often not. Abnormal bleeding is probably the most common, but it's such a common symptom that, I've maybe found like 2 people in my career that were bleeding, and the reason they were bleeding was cervical cancer. So I wouldn't worry that if you're having weird bleeding, that means it's cancer. but I would definitely say if you're having weird bleeding, get checked out. Um, the interesting thing on that whole topic is just cervical cancer screening and what's the latest on that. And probably a lot of you guys already know this, but we are not doing PAPs every year anymore. The science is really clear that things that are precancerous to the cervix start with human papillomavirus, HPV. And if you don't have HPV, you're pretty much not going to get cervical cancer. So we're doing HPV testing on anybody 30 and up, and in a lot of situations between 26 and 30, depending on the results. So, the interesting thing about that is if you're HPV negative, you don't need to worry about it. Keep getting your PAPs as you're directed, but don't stress. But then beyond that, if you're having weird bleeding, I'd get it checked out. Let's see. Alexis. For patients with PCOS, is there a more reliable way to check if you're ovulating? LHRs all the time, never ovulate. Yeah, I mean, actually the best predictor of ovulation is cervical mucus. So if you follow your cervical mucus and you notice the changes that are associated with ovulation, that's actually the best predictor of when ovulation is occurring. So I talk about that in my YouTube video that's called Maximizing Your Natural Fertility. So, maybe check that one out, and I go into it in a little bit of detail. But bottom line, the cervical mucus is really the way to go. So you might check that one out. Okay. Put your questions in the chat. I'll be happy to answer them. I'm going to go answer my doorbell, I think is ringing, and be right back. But hit me up with some questions. Oh, you came that way. That's good for you.
I thought you were still doing a live stream.
Oh, it's all good.
I was doing it.
I was waiting for the dogs to go nuts.
No, I didn't. I wanted there to say what you got.
So smart. All right, cool. All right. I'm back. We'll see if anybody left me any questions while I was away. So far, so good. Okay. Well, let's see. We've been going here for about 30 minutes. So if anybody has any other questions, pop them in there now. Oh, here comes one. Let's see what we got. Miranda was taken out September 2 years ago. Irregular periods since then, some long, some missed totally. One chemical pregnancy with the IUD. Would the IUD being in for 5 years still be the cause of any of this? No. I do not think so there, Samantha. Generally speaking, the contraceptive effects of an IUD are reversed at removal. So I suspect that your irregular bleeding has nothing to do with the IUD and maybe something else entirely. And so my advice would be, if it's been that long and it's been that weird, go see your doctor, get checked out. The kind of things I'd think about, get an ultrasound, take a look at the uterus, do some hormonal testing, check your thyroid, some things like that. And I think that, you're probably gonna have a better chance, of explaining your abnormal bleeding through that evaluation than just thinking that it's the IUD. So probably not the IUD. I'd get that checked out though. Let's see. Alexis, follow-up question. If you never had cervical mucus changes, what would that cause? It's a good question. PCOS. Well, the thing about it is, if you're PCOS, one of the hallmarks is just infrequent or irregular ovulation. And so it might just be that sort of the normal pattern that your body would follow when you're ovulating regularly is just not there. And so the cervical mucus just doesn't follow the right pattern either. And so if you have PCOS, if your periods are irregular and you're trying to get pregnant, then ovulation induction is really the way to go. Clomid, Femara, things like that. Maybe metformin. If you have resistance to Clomid and Femara, you might consider doing metformin after that, but it's really not considered first-line treatment to induce ovulation. Now, a lot of people use it for metformin. A lot of people use metformin for PCOS symptom control, reducing insulin levels, stuff like that. But when you look at the data regarding pregnancy outcomes, it's not super duper convincing, except in the subset of patients who are Clomid and Femara resistant. There may be some benefit to adding metformin at that point. Okay, let's see. Taylor, at 40 weeks, how long after blood show losing mucus would you go live? Possibly anywhere from that day to a week. There's just not tons of correlation between when you start seeing some mucusy discharge and when labor actually starts. So that's not a super reliable sign. It does certainly happen. You hear that story, but I've had tons of people who said, "Oh, I lost a mucus plug like a month ago." So I don't worry too much about that. Just watch for the contractions. Let's see, Vanessa, is there a way to pinpoint why your milk dries up or what may cause it? Yeah, that's a tough one. Some medications can do it. So, oh boy, dog's got a squeaky toy. Sorry, guys. Milk supply, antihistamines can definitely mess with your milk supply. There may be other medications that can do it. I always encourage anybody who's having concerns about breast milk to talk to a lactation consultant. Sometimes there's things you can do in terms of how the baby's nursing and things like that might help. Definitely, I think they're often going to tell you nurse and then pump after you nurse, because it is kind of a supply and demand system. So the more demand you put on the breasts, usually the more milk supply you'll have. Beyond that, sort of why exactly in an individual person's case, it's often hard to know. Taylor's like, no. There's still hope, don't worry. Okay, let's see. All right, I think I'm caught up. Let me just see if anything popped up over here on YouTube. I thought I saw something. Let's see. Why do some doctors do fresh transfer, some do frozen when doing IVF? That's a good question. There's actually data out there now that frozen embryo transfers have better pregnancy outcomes than fresh embryo transfers. I don't know why. I'm not a fertility specialist. I don't do in vitro. I'm your general OBGYN, but I have some knowledge about this topic. And I read an article not too long ago that was looking at frozen embryos versus fresh embryos, and it actually showed better pregnancy rates with frozen embryos. Not sure why that is. It was a new study. So you may see some places shifting to that, and that might be why when you're saying why do some doctors do frozens, that might be why. But it's a new concept. So I would definitely encourage you to, if you're going down that route, to talk to the folks that are doing your in vitro cycle and get their input. Yeah, doing frozen. That's probably why. All right, let's see. Do we do IUIs? Yes, we do. We do. So we can do fresh specimen processing and do inseminations. So if we can have a fresh sample provided to us in the office, we can process it right there and do inseminations. We also can do donor inseminations, say from like a cryobank, like California Cryobank. You just have to get it shipped to you and bring it in with you when it's time. And we do the thaw and do the insemination. So yep, we got it. We can do it. Sorry if you guys hear my dogs back there. They're kind of like running around and playing. All right, I think I'm caught up. Let's see if there's anything over here. I don't think I'm caught up on YouTube. Looks like I'm caught up on Facebook too. So let's see. We've been going for almost 40 minutes. We'll maybe go for another 10 or so minutes here. As long as questions are coming in, I'll keep answering them. So if you guys have anything, feel free to fire away. Okay, well, we'll give it another couple minutes. I'm not seeing any other questions pop up, so we'll give you guys another couple minutes. If you have a question, fire away in the chat. Otherwise, maybe we'll wrap it up for the day. If somebody's jumping on new and you have a question, feel free to put it in the chat and I'll be happy to answer. It's been a minute since anybody, since you guys saw my corgi puppy, so I don't know if anybody cares about that. In the past, people have mentioned it to me. So let me see if I can find him real quick. There he is. Chance. Chance. And that's Buddy licking his head. So there's the dogs. Somebody told me one time the best part of my videos was the dogs. So I'm feeling pretty good about that right now. All right, cool. All right, so we'll give you guys another couple minutes, see if there's any other questions popping up. So far I got nothing. So maybe we're running out of questions for the day, which is totally fine. Happy to answer them if you have them, though. Yeah. Aw, he's something. His favorite toy is Squeaky, as you've probably determined. Oh, I didn't show you guys on YouTube if you want to see this dog. There he is. I just walked away. We'll catch him when he comes back. All right, is there a certain age when end quality and quantity drop? Yeah, and it's different for everybody. It's possibly genetically determined. But if you look at data, if you look at pregnancy data, just that's a simple number to look at. 30 is kind of a break point. It doesn't mean you can't get pregnant after 30 by any stretch. But if you look at like chances of conception per cycle, they do start to decline after 30, just on average. Now, for an individual person, it's not that easy to predict. And there actually is a video on my channel that I put up recently that talks about this. So there's some testing that has been done in the past, and I did, because there's old studies. Sorry, give me that. Give me that. This is how it goes. Give me that. All right, there we go. He wants me to throw it, but he's gonna have to wait. There are tests that you can do, like the AMH test, FSH, inhibin levels, stuff like that, to try to predict your chances of pregnancy, and they just don't work for spontaneous conception. So that's the main thing to know. And I made a video that talks about that in some detail. So if you're curious, you can check it out. Carissa, thanks for answering another question. Yeah, we delivered Ogden and McKay. Last time got a question if we're going to be delivering at the Layton Hospital, and the answer is we're not. A little too far away from our practice, and we feel like Ogden and McKay offer all the services that we would need to have for our patients. And Layton's going to be more of a community hospital that is not going to have every service that you have offered at Ogden and McKay. So we're going to stick with those two. We feel like those serve the patients the best. So yeah, let's see. Am I accepting new patients? Yeah, oh, absolutely. See new people every day. More than happy to see you. All you gotta do is give us a call. The number is probably on this Facebook page somewhere. You can click and make an appointment, or click and get a phone number to call and get an appointment. So yeah, happy to see you, Alexis. All right, oh, there's the dog, you guys, on YouTube. There he is, see? That's Chance. So, cool. All right, somebody's just jumped on there on YouTube. Come. We're answering questions live. Somebody jumped off. Maybe they just saw it and ran away. Answering questions live. If you have questions, put them in the chat. We'll probably be going live here for another 5 or so minutes. So here's your big chance. Ask me anything. Can you get more info? Let's see. Can you get more info? Oh, sorry. You said how old are your puppies? Maybe that's what you mean. Let's see. Chance is almost a year old and Buddy's 10. Chance is the little corgi and Buddy's the golden. I assume that's what you meant by can you get more info? I'm not certain. If that's not what you meant, let me know. Let's see. How did postpartum hemorrhage was likelihood of a second? That's a great question. And I don't know that anybody really knows, but it's probably in the neighborhood of a 20 or 30% increased risk over baseline for someone who's not had that in the past. But beyond that, it's hard to really know because there's so many factors that go into whether or not someone has a postpartum hemorrhage that it's hard to know from just that one piece of information what the chance is. But we know the risk is a little bit higher. It's one of those things that they score patients on when they come in labor, is their hemorrhage risk assessment, and that is one of the risk factors, but it's not the only. So some other things you look at, number of babies. So the more kids you've had, the higher the risk. Length of labor, dose of Pitocin if you're on Pitocin, those are all things that increase the risk. Infection can increase the risk. So those are the kind of things they look for your hemorrhage score, but it's hard to pinpoint it just based on the history alone. But maybe slight. Okay. The flu. Maybe you're asking about that. Was that your question about the menstrual flu? Yeah, I don't know if I sort of said kind of all that I knew about that earlier, but basically it's just down to prostaglandin metabolism for some people. I don't have a specific reference to quote to you on that. It's not something I've had a lot of people complain about. But like I was saying before, non-steroidals like ibuprofen or naproxen could potentially help, so I would recommend try those. Beyond those, I don't have like a great recommendation, sorry. I'll look into it. I'm always looking for new stuff to talk about, so I'll make a note to myself to try to read up on that, and maybe I'll have a video for you. See if I can find anything. And if nothing else, I'll just mention it on the next live that I couldn't find anything about it. So the menstrual flu. Okay, I've left myself a sticky note, Megan. I'll look into it. All right, cool. Okay, guys. We'll give another minute here, see if anybody else has questions. Otherwise, I think we'll wrap it up for today. I think we're good over on YouTube too. Hey guys, if you guys have questions on YouTube, hit me up because I think we're gonna wrap it up here in a couple minutes. We do these most Fridays, usually around 2 o'clock. Today was a little bit later because I had some deliveries earlier. Also, if you haven't seen the YouTube channel, check it out. I know if you're watching me on YouTube, you have. But if you haven't, then if you're over here on Facebook watching, check out the YouTube channel and we'll go from there. Let's see. Stephanie, just found out you're pregnant. Congrats. And how soon do you recommend making an appointment? Generally around 6 to 8 weeks. So if you just found out, just give a call and make an appointment for your new OB visit. We typically can get you in within a week or so. So anywhere in the next week or two is perfectly fine. And congratulations. Cool. Okay. We'll give another minute here and see if anybody else has a question before we wrap it up for the day. Oh, hey Stephanie, by the way, check out, there's a YouTube playlist on my channel that's called Watch These First If You're a New Mom. And it's like all the questions and all the answers. I put them all into one playlist. There's like 10 or 14 or some number of videos that are kind of like all the commonly asked questions that everybody always asks, like, can you dye your hair, can you eat sushi, all the stuff that everybody wants to know. So check it out, awesome, and we'll see you soon too. That's great, congrats. All right, let me see, something just popped up over here on YouTube. Let's see what it was. Are the ovulation test sticks accurate, the ones on eBay? Probably as good as any. They're all just testing for that LH surge that is the chemical signal that you're ovulating or that you're about to ovulate. So yeah, I think the any over-the-counter ovulation kit is fine. And then also there, like I said, on my YouTube channel, there's in that playlist of the trying to conceive, there's one called Maximizing Your Fertility. It's about cervical mucus tracking. Really is the best predictor of ovulation. So you might check that one out. Let's see. Would you need to do any testing? Is it hormonal? Yeah, if you're talking about that flu thing, yeah, I don't think so. There's really not commercially available lab tests to look at your levels when it comes to prostaglandin metabolism. So it'd kind of be a little bit more just trial and error, I would imagine. All right. Well, I think we'll wrap it up for today. Thanks everybody for jumping on YouTube and Facebook. I appreciate all your questions. Otherwise, I got nothing to say. So thanks so much for your questions. Thanks for watching. I really enjoy doing these. Try to catch me every Friday or most Fridays around 2 o'clock for the Facebook Live. So we'll see you next time. If you haven't checked out the YouTube channel, check it out. Wes D Ski is how you can find it. If you just go to YouTube and push in Wes D Ski, I'll just type it there for you. You can find the channel and you can see all these playlists I've been talking about. All right, guys, I think we'll call it good for today. Thanks for watching. Hope you have a great weekend. Happy Labor Day. Hope we don't have to work Monday.